Medicine, the ever-changing world of life and death. Technological advances push forward new drugs and create more medicines to treat the same diseases with altered symptoms. New synthetic drugs are being developed that treat diseases that patients used to die from due to the unadvanced equipment. Doctors are spending less time with patients because they have so many. The main question we should be asking ourselves is, how far is this new medicine going to take us? The first area we should look at is where it all began: the Egyptians. The Egyptians had the earliest documented form of medicine and influenced many civilizations to come. The Egyptians had knowledge of the human anatomy. Like in the mummification process, mummifiers knew how to remove the brain by going in through the nose. They also had a general idea of the location in the body cavity of the inner organs. Egyptian physicians were aware of the existence of the pulse and of the connection between pulse, heart, and consciousness. Evil gods and demons were thought to be responsible for many ailments, so often the treatments involved a supernatural element, such as the beginning a treatment with an appeal to a deity. In the 1800s, doctors and scientists began experimenting with medicine. They were able to create the first blood transfusion, but it dealt with direct transfusion with someone right next to the patient. Pregnancy was a big medical procedure then, and many women died from complications that doctors today are able to foresee and prevent. In the 1800s, anesthesia wasn't quite invented yet, so procedures like amputations were performed on people who were awake and had no pain medicine. But towards the late 1800s, early 1900s, scientists were able to create anesthesia and in turn saved a lot of people from a lot of pain. In the 1900s, medicine began to grow exponentially, as did the technology available. Hospitals were enlarged and patients were placed in different sections based on what they were there for. Medicine was perfected and more was being tested and mixed. Surgeries used to be a miracle and were performed in front of a lot of people, but they were moved into private rooms with only nurses, surgical aides, and surgeons in the room. The first female doctor was allowed to practice medicine. She said, "It is not easy to be a pioneer, but oh, it is fascinating. I would not trade one moment, even the worst moment, for all the riches in the world." The world, in fact, saw its first African-American physician, James McCunnen Smith, and its first female African-American physician, Rebecca Lee Crumpler. Insulin was used to treat diabetes. The first vaccines for diseases like diphtheria, pertussis, tuberculosis, tetanus, yellow fever, influenza, measles, mumps, rubella, chickenpox, pneumonia, meningitis, hepatitis, and Lyme disease were all created. The first pacemaker was developed to treat irregular heartbeat. Dr. Christian Barnard performed the first heart transplant surgery. The first in vitro baby was born. The first blood bank was opened. Penicillin was created. Animals were cloned. Old diseases were identified and treated, like HIV. As technology is growing, so is the possibilities of medicine. It is near impossible to predict where medicine will go or how it will affect everyday lives. Advances in medicines are leading to people living longer, and many are being saved every day from these advances. The only question left is, where do you think medicine will be in the future?